is Karen Curtis, and I am a Provider Outreach and Education Specialist here at WPS. Today I am joined by my good friend Aline Ziegler. Aline will be monitoring the chat for questions as well as providing you with some additional information and links. I have just a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and you would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center, along with a list of our upcoming events. Aline will also add a link to the chat to get you there quickly. Our training center also contains a web page for our encore presentations. Videos are available for up to 90 days and can be watched on our webpage without having to go to YouTube. We know that some of you are not able to access YouTube from your company computer, and we want you to be able to receive the education that interests you. Each encore is posted with a link that will allow you to download a copy of the presentation, and you'll also be given another chance to complete a survey and provide your feedback. Today's presentation is being recorded, and if there's no technical issues, it will be posted to our website within the week. Later, there will be a question and answer session if time permits. If you have questions related to today's topic, please send those in the chat feature. If there are any questions that I don't get to, or if some require additional research, an email will be provided. Those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want you to know that we want to know how we are doing. So later in this presentation, you'll be given the opportunity to fill out a survey. This is your chance to let us know what we're doing right. Let us know if you feel that there are areas where we can improve. And it also gives you the opportunity to give us input on what types of education you'd like to see in the future. While this is a CMS survey, WPS does look at our results, and we do our best to make the improvements you ask for. Now, here at WPS, we do our best to provide you with accurate and up-to-date data. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should always be checked for updates, and federal regulations take priority over anything presented today. Today, I would like to show you some tools on the WPS website that might be able to help you determine if your claim paid correctly. We have heard from our customer service, redeterminations, and audit team that providers have questions as to whether or not they received the correct payment. So today I'm hoping to show you some WPS tools that can help you make this determination and hopefully save you time so that you don't have to file those appeals or make phone calls if they're not necessary. Now we'll start off with the MSP Calculator. This tool should be used for outpatient claims where the primary insurer is working aged, end-stage renal disease, or disability. Payment can be calculated at the line or claim level. I will do a little demonstration of this in just a few minutes, but it does have where you can calculate it. Here you can add lines. Here's to calculate. You can clear the form. You will notice a box which asks for the OTAF amount, and this is the amount that the provider is obligated to accept as payment in full, and it can be found on the primary payer's remittance advice. This amount can also be the same as the primary insurance allowed amount. So you simply fill in the boxes, you hit the calculate button, and if Medicare were to make a payment, it would be shown in the result box under the Medicare will pay. So here you can't see that, but we will go out and take a look at it. Now, earlier this year, our claims department posted an article to the website to help providers who may have Part B claims that have dollar amounts over 7 digits. Our claims department said that they mainly see this occur in claims that are scanned through the optical character recognition or OCR process. So for example, if a provider submits a claim with a line level charge of $870,000, the OCR isn't able to read the 8-digit and the charge is loaded as a $70,000 charge. So I'm sure you could see where this would cause problems with reimbursement. And again, we'll take a little bit closer look at those instructions in just a few minutes. The annual rate information webpage was actually developed by a member of our audit department. Here you can find links to federal rates for each type of facility, value-based purchasing factor and quality reporting files for SNFs, and there's an annual rate FAQ. Now, the Part B fee schedule and reimbursement guides and resources webpage is where you can find links for the provider physician's fee schedule and specialty pricing. These links will take you to web pages where you can download fee schedules, you can find information about pricing updates, along with some additional resources. So let me take you out there real quick. So I'll start out with the MSP Calculator. We'll go to Medicare Part A, Tools. Under All Tools, you'll find the MSP Calculator. If I hover over it, it'll tell you that it should only be used for MSP types 12, 13, and 43. And I'm just going to plug in an example so you can see how this works. If we do an amount billed of $500, we'll say the OTAF amount is $400, primary paid $300. We'll say the Medicare allowed amount was $400. The patient's already met their deductible, so that's not owed. And we'll say that the primary allowed $300. If I hit calculate, we can scroll down and it shows you that Medicare will pay $100. So this way, if you're kind of questioning your payment from an MSP claim, you can go out here, enter the information, and kind of check that to see if it's equaling out to what you got. There is a spot here for late filing. If I click that and hit calculate, it does reduce the Medicare payment. Now, the next resource I wanted to go to is the dollar amounts over 7 digits. This is a Part B resource, so let me switch and choose a Part B jurisdiction. I'm going to go to Claims. And we'll scroll down here. Under Claims Submission. And we have the article submitting claims when the dollar amount is greater than $99,999.99. So earlier I had mentioned that claims had an example where the claim contained a charge for $870,000, but when it was scanned, it was uploaded as $70,000. So in order to avoid this issue, you're going to want to split your bill and submit multiple claims. Now, I do want to point out right here, it says that your total dollar amount will need to be different on each claim. So make sure you take that into account when you're submitting these multiple bills. You're also going to want to include modifier 76 to indicate that it's a repeat service. And in the narrative, give the number of units billed. It tells you down here that in box 19 of the CMS 1500 form or in loop 2400, you'll want to enter, this is claim 1 of 2, and you're also going to want to put the number of units billed for that claim. Now, the reason that you're going to want to do that is because when you follow these steps, your claim is going to be manually reviewed by a claims department employee. So if you let them know, hey, we have 5 claims and this is number 2 of 5, then they know that they need to go out there, look and make sure they have all 5 of those claims and that they can work those correctly. Now, the next page I want to show you is the annual rate information page. This is found under Part A. I'm going to go to the fee schedules and reimbursement. I'll scroll down here to the interim rate. And here we have the annual rate information. So this web page was created as sort of a catch-all of information. It starts out with links to the federal rates for each provider type. So you can see it's got the inpatient prospective payment system for hospitals. It's got inpatient psychiatric facilities, rehab facilities, skilled nursing. If you have a question on a claim payment, I want to call your attention here to the CMS Pricer. So if you have a question on a claim payment for any inpatient claims, this is where you're going to want to start to determine if you received an incorrect payment. Now, if the payment shown, it has a link right here for the Web Pricer. And this will take you out to the CMS website, and then it has the different Web Pricer applications. So if the payment shown in the Pricer matches what Medicare paid, then you're going to need to review your calculation and verify that the rates match. Now, our redeterminations department has told us that they receive a lot of underpayment appeals on inpatient claims. But when they come out here and they run the claim data through the Pricer, and then they'll take like the pass-through and the coinsurance and the sequestrations amounts, and when they subtract those, they find that the payment that WPS made was correct. So and they also noted that these requests are sent without any explanation of how they calculated, what their payment should be, and there's no copies of the Web Pricer that are sent in. So in order to kind of help you and reduce the amount of work that you have to do, if you go out here and you use these pricers, if you do find that there's an error, go ahead and take a, copy of that, send it in with your redetermination, and that way our departments know, okay, yeah, we did pay it wrong and we need to do some work on it. Now I'm going to go ahead and I'm going to click on the inpatient PPS Web Pricer. Now you're going to see that there's an option here for a provider directory. So this is something that you're going to want to use. If you're questioning what rates are being used, you can do this visit provider directory. This is an identical copy of what is loaded into the provider specific file, and the data is pulled daily, so this is an accurate tool to use. We're going to go back now to our website. Now, if you're a SNF and you need a value-based purchasing factor or quality reporting, you can see that these can be found here. If you do scroll down, here is information about finding DRG payments in the FIS for direct data entry. Down here, I also found this to be very helpful. There's an annual rate FAQs. So it has questions about my claim paid less than I was expecting, and it gives you steps so that you can follow through and see if it actually did pay correctly or not. And the Part B, we're going to go to Part B here, and I'm going to show you where you can find the fee schedules. So we'll click on Topic Center, Fee Schedules and Reimbursement, and here's where you can download the Medicare physician fee schedules. There's also specialty pricing out here. So the Medicare physician fee schedules is used to determine payment for professional services in private practice, services covered incident to physician services, diagnostic test, and radiology services. So if I click the link, let me scroll down. You can see that the files are broken down by state and by locality for the state of Missouri. Now, earlier I downloaded the Iowa file. So you can see here, I'm going to scroll back up to the top. It lists the procedure codes for you. It gives you the amount for participating providers, for non-participating providers, and there's also a limiting charge. Up here it tells you that that applies to unassigned claims by non-participating providers. If there's a number sign, this is if the service is performed in a facility setting. Also, if I scroll down a little bit here, you'll see that it kind of breaks it down also if there are modifiers involved. So you can see for G0105, it has the pricing, then it has separate pricing if it's in a facility, pricing if it has modifier 53, and pricing if it has modifier 53 and was performed in a facility setting. Now, if I go back and I look at the specialty pricing, this would help if you're looking for fee schedule links for ambulance, clinical lab, DME, all that's listed out here with links. You can also find pricing links for anesthesia, for vaccines, and it even gives help with, it gives you a special note. So if you're trying to look for pricing for nurse practitioners, physician assistants, and clinical nurse specialists, it kind of gives an exception here. To determine the fee, you have to multiply the fee amount by 85%. So just a little note to help out if you're looking for pricing for that. Now I am going to go back to our slide presentation here. I did provide links for all of the information and all of the sites that I took you to. Hopefully you will find that helpful. I do want to save time, and I'm going to ask Aline if we have had any questions come through in the chat.
Hi, Karen. Thank you for that. I know that there were a couple tools that I wasn't even aware of, so thank you for that. We do have one question, and it says, is there any specific reimbursement tools for FQHC?
Let me see. Noelle, are you on the line? Okay. I can check with our audit department. That is a great question. I can check with our audit department and I can find out if there is something specific for FQHCs, and I can send that out to everybody that is in attendance today.
Thank you so much. That was the only question in the chat at this time.
Okay. Thank you. Well, I wonder if some of you have heard that CMS has issued CR 13754, which has directed MACs to disable the eligibility portion of our interactive voice response system, or IVR. This is being done to help protect beneficiaries from Medicare fraud and make sure that personal health information is only provided to those who need it. At this point in time, it is a pilot, so we will wait for CMS to make the final determination on whether or not it will be removed entirely. WPS does plan on disabling this function on January 1st of 2025. Now, there are other options available to check eligibility. Those include the secure portal, direct data entry, or DDE for providers who use the FIS system, and the HIPAA eligibility transaction system known as HETS. Provider Outreach and Education does plan to have multiple webinars on these options, so be sure to check out our live events page for a time that'll work for you. Now, CMS is dedicated to promoting health equity and has recently updated their framework. So they've kind of asked MACs to promote this new, this kind of promote what they're working on. And if you're interested in learning more about health equity policies and programs offered by CMS, you can click on the link found here. CMS does do a great job of providing resources on different topics. I went out there and have looked around, and they have recorded webinars and training. So if that's something that you're interested in, it's really a helpful place to check out. After the close of today's webinar, you're going to receive a thank you for attending email. And here is where you're going to find your proof of attendance and contact hours for continuing education units. This email also contains a link which gives you another opportunity to provide feedback. If you do not get this email, check your spam or your junk folder. You will also need to add messenger@webex.com to your safe sender list. Now, if you joined only by phone, you will not receive this email. So please send an email to the wps.gha.education@wpsic.com with your name and phone number that you used to join so that we can send a certificate directly to you. If you do think of any questions after the webinar, you can still send those in. Email those to our education mailbox shown here on the screen. And we normally say 7 days, but because of the holidays, we're going to extend that to December 2nd. Be sure to put today's topic in the subject line so that staff will know that your question is related to this webinar, and they'll send it directly to me. Now remember, if you have a question that's claim specific, then those should go to customer service because they have access to the system and can answer your question based on how your claim processed. When you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Aline add a link to the chat. Your feedback means a lot to us. We review what you have to say, and we do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you'd like to see us provide education on in the future. So if you have something specific, that would be great. Also, if you have ideas that you think would improve how you receive your education, be sure to tell us those too. The redirect looks like what you see over here on the bottom right. We don't have control over how this appears, so we just show it to you so that you know it's not spam or anything malicious. That brings us to the end of today's presentation. On behalf of myself, Aline, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.